C-section rates are climbing all around the world, with some countries having more C-sections than vaginal deliveries. Why is this? Are they always necessary, or are they sometimes overused? And what is going to be right for your birth? Hello, my name is Emma and welcome to the channel She Revolves, or welcome back. So this channel is all about supporting women through various cycles of their lives and also through motherhood, where suddenly we're transitioning to making our lives revolve around one little person or multiple little people. So I'm a prenatal yoga teacher and training to be postnatal yoga teacher as well. And I'm a new mum. This is Marvi and she is just 1 month old. So if you're excited about finding a space that's supportive, empowering and positive, then please do subscribe to the channel and join the revolution. So first of all, this video is part of my birth series, which I was in the middle of when I gave birth to this lovely little creature. So if you haven't seen the other videos already, do check them out. But I'm going to be continuing the birth series now. And I also just published a video on my birth experience, which was very positive. So if you want to check that out, if you're curious, then feel free. So in this video, we're going to cover what is a C-section, why are they on the rise. We're also going to look at pros and cons and recovery, and then to consider what is going to be right for you. First of all, what is a C-section? So a C-section or Caesarean is where an incision is made in your belly to remove your baby. So it is major surgery. They make the cut, they remove the baby, they also remove your placenta, and then they stitch you back up again. It is also possible to request a gentle C-section, which is where you're more involved in the birth. So things like not having the screen so you can actually see your baby being born, having certain music on in the background. So you can request that if you have a doctor willing to discuss these things. And importantly, there are two types of Caesarean. You have an elective C-section, which is where it's scheduled ahead of time and planned in advance. And you have an emergency C-section, which is when you're already in labor and for the safety of mum and or baby, the baby needs to be delivered right away, and so you go to the emergency room for a C-section. Regardless, you're going to need pain relief. So most commonly an epidural is used, but you can also in some cases use a general anesthetic, which is only used in like 5% of cases, but it is more common in emergency scenarios because it's a little bit quicker to administer. Why are C-sections on the rise? So first of all, the World Health Organization has actively said that they believe C-section rate should be 10 to 15% around the world. On average around the world, they're saying that it's around 20%, but in some countries it's crazy high, like higher than 50%. So countries like Dominican Republic, Turkey, Egypt, Brazil, and a few others, you're seeing C-section rates above 40% and even 50%. So why is this happening? First of all, it's good to have like a baseline. There's a really great book called Ina May's Guide to Childbirth. I refer to it a lot in my videos. And I've done a video summary of the book, which you can check out. But she's a midwife and very hippie, natural birth orientated. And at her birthing center, they had a C-section rate under 2%. And they did thousands of births. And I'm pretty sure, but I'll double check and I'll amend in the below if it's not true, that they had 0 fatalities for mother and baby. So below 2% is possible in a hippie natural birthing center, but we're seeing on average 20% around the world. So first of all, it seems both elective and emergency C-sections are on the rise. I'll show a little graph this is from Scotland, but I imagine that it's probably the case around the world that both are increasing. So why would elective be increasing? So I think it's becoming more and more common that women have fear around childbirth and vaginal delivery. So that's one thing that they're just choosing to go to a C-section. You also have the convenience of booking your C-section date in advance, which also may reduce anxiety for some women, just knowing I'm going to be giving birth on this date. If we look at emergency C-section rates, which are also on the rise, I think this is due to the medical nature of birth and how it's becoming more and more medicalized. Check out my previous video on induction, which talks a lot about Pitocin and Pitocin's effect on labor, but also the chance of having or needing an emergency C-section. So watch that video and see what you think. But I'm of the opinion that the increased use of Pitocin for augmentation and induction has increased the C-section rate. And also there are studies, there's mixed studies on this, but there are studies showing that epidural also increases the risk of an emergency C-section. So in a medical setting, we're seeing more and more emergency C-sections. What I can't find studies on, but I've heard this many times from different people, and it makes sense, is also doctor's convenience. If you're a doctor and you have the choice of your client laboring naturally for 24 hours, having to monitor them continuously, maybe different issues arising and keeping tabs on it, and potentially it resulting in emergency C-section anyway, you might be inclined to say, look, why don't we just schedule your C-section, and that way it's all calm and it's a standard procedure and you can be home for dinner with your family. So this definitely has a part to play. And also, depending on the medical system that you're in, if it's like a private system or insurance-based system, there's also some financial incentives to do more cesareans because it makes more money for the hospital, which is sad but true. And regardless of what you want, make sure you really ask these questions to your doctor, like what percentage roughly of deliveries result in a C-section, or try to gauge their opinion of C-section, because you'll kind of get an idea of how likely they are to recommend that you go down that route in the end. My doctor, at one point, her heartbeat wasn't doing so well during the labor towards the end. And I just said, like, if you need to do a C-section, let's just do a C-section. I want her out, I want her healthy. He was like, whoa, no, we're gonna keep monitoring. And like, he actively was pushing me not to have a C-section, which was just great, because I think many other doctors, especially in Dubai, would just be like, sure, let's go, let's do the C-section. Before we come on to the pros and cons and recovery, if you are enjoying this video, please give it a thumbs up. It's just one little click and it makes a huge difference for a small channel starting out like mine. So thank you, let's move on. So what are the benefits of a C-section? C-sections are incredibly important, and I think many natural birth advocates, which maybe I'd consider myself a natural birth advocate, demonize C-sections. I am not here to demonize a C-section. They are life-saving procedures in many cases for mum and or baby. Plus, for some people, it's what's right for them. If you're incredibly anxious about vaginal birth, or not knowing when you're going to come into labor, or maybe you've had a horrendous third trimester and you just want it scheduled and you want the pregnancy done. There are many different considerations, but you may weigh up the pros and cons and decide this is the best route for me. You also have less chance of tearing and damage to the perineum or the pelvic floor, so that's also something to consider. Let's look at the risks. So you do have an increased chance of infection because you have a big wound where the incision was made, and infection can be between like 3 to 15% depending on where you are in the world. You have an increased chance of hemorrhaging, so cesareans in general, there's more blood loss. With a vaginal delivery, on average, you lose around 500 ml, whereas with a C-section, it's on average around 1,000 ml. An interesting one is blood clots. So women who had a planned C-section are twice as likely to have a blood clot as women who delivered vaginally. And the risk is 3 to 4 times as likely if it's an emergency C-section. You've also got longer recovery with a C-section. We're going to talk about recovery in more detail in the next section. But in general, you're required to stay in the hospital for longer, and your recovery at home is longer. If you're intending to have more children, you've got an increased risk during your deliveries of your future children due to the weakened scar. Ooh. Are you getting a bit warm in there? Then we have breathing difficulties for baby. So first of all, because it's often scheduled a little earlier than 40 weeks, your baby hasn't developed their lungs fully. Do check out my video on when will I go into labor, I think that's the name of it, which talks a lot more about this. So as a result of it being an earlier delivery, they already have a higher risk of having breathing difficulties, but also during a vaginal delivery, the baby is kind of like squeezed, so that liquid is squeezed out of the lungs, ready for that first breath. And this does not happen in a C-section. And actually the numbers are quite drastic. So at 37 weeks, which isn't recommended anyway, but 10% of babies born from a C-section experience breathing difficulties, compared to 2.8% if born vaginally. Hello, little dinosaur. And then at 39 weeks, it's 2.1% of babies from C-section have difficulties compared to 1.1% of babies born vaginally. Next up is microbiome. So this is a really interesting topic and a lot more research needs to be done, but it's clearly been shown that babies born vaginally compared to those born from a C-section have very different microbiomes a few days after birth. And the microbiome is being proved and being shown to be very important for overall health in our adult life. So the very first colonization of these bacteria in the body happens at birth, and it could be the case, it's still more research needs to be done, that due to this difference in microbiome, your baby is more likely to have issues such as asthma, obesity, diabetes, as a result of different sorts of bacteria that have grown in the gut. And finally, we have breastfeeding outcomes. So it's been shown that if you give birth vaginally, you have better breastfeeding outcomes. You're less likely to need supplementation of formula, that you're more likely to have increased sessions of feeding, and you're less likely, you experience on average less weight loss in those first days of life. And there are even some studies which are showing a link of C-section to ADHD and autism spectrum disorders, but they aren't very conclusive. So that's all of the risks, and some of those are big, some of them are small, some of them are sort of temporary, some of them are long-term, and you can find many different studies online, so it's up to you just to weigh those pros and cons. Recovery and healing. So a C-section takes a little longer to recover from. You do have a big incision and wound. So it's advised that you don't lift anything heavier than your baby, that you rest. There's the 5-5-5 rule for postpartum, which especially should apply to Caesarean deliveries. So 5 days in the bed, 5 days around the bed, and 5 days what's the last 5 days? Around the house? I think so. So basically just chill out and make sure that you recover slowly. You can also check out, I'm a huge fan of the Expecting and Empowered app. It's made for pregnancy and postpartum, and it's made by two sisters, one of whom is not a personal trainer, a physiotherapist. So they have day-by-day guidelines of what you can do after a Caesarean delivery. So day 3, massage around the scar and walk for 2 minutes around the house or something like that. So it's just very little, they're not even workouts, they're just ways to wake your body up. And they also have plans for vaginal delivery as well. It's just fantastic, so do check that out. Yeah, and just rest up, and if you can, get some help, family, or anybody to come and help you out, then do that, especially if you have other children, because it's difficult to look after a toddler when you can't lift them up due to your scar. So should you choose a C-section? So this completely depends on you, on your pregnancy, so many different things, but I hope that this has been helpful to outline the general pros and cons. If the main reason that you want a C-section is about fear of vaginal birth, then I would really recommend 1, checking out the Ina May video that I've done, and 2, doing hypnobirthing. I really think that worked for me with my birth, because throughout most of my birth I was not scared, and for large parts of it I felt very empowered and excited about what was happening. So depending on where you are in your pregnancy, if it's fear that's pushing you to a C-section, then it may not be too late to transform those fears. And the most important thing is to be informed and educate yourself on when a C-section is needed, when it's not, and to ask questions to your doctor. Don't trust anybody blindly. I know so many women who just say, oh, I'm not doing any research because I trust my doctor. And I personally, I talk about this in the first video of the series, I think this is a bit silly, because there are many reasons that a doctor may want to do a cesarean. They might have different beliefs than you and values and what's important, what's not. So make sure that you ask them plenty of questions to understand their views and to express what you want in an ideal scenario. And it's never too late to change doctor. I heard a story of one lady who literally, she was 5 centimeters dilated already, and they were pushing her to do augmentation with Pitocin in the hospital, and then she said no, and she got in her car and went to Faki, which is where I gave birth, and changed hospital while she was already 5 centimeters dilated. So it's never too late to change doctors if once you've asked them some questions, you realize that it's not a good fit. All right, and that's pretty much everything. Were there any of these facts that surprised you? Where are you sitting? Are you more on the C-section side or more on the vaginal delivery side? And if you have any questions, please do pop them in the comments. I do check them all and I will reply. And again, if you enjoyed this video, please do subscribe. She's pushing me with her little hands. Please do subscribe to the channel. And I'm going to be doing a lot more related to parenting and newborn life and how it's going in these first weeks and months. So yeah, hope you enjoy the videos to come. And I've got one more video left of the birth series, so do look out for that as well. And I'll see you back on the channel soon.